You walk out to your quail pen this morning and something is wrong. A bird is sitting in the corner, fluffed up, not eating. Another one has watery droppings, your stomach drops. You don't have a vet on speed dial. You don't even know what you're looking at yet. This video is the one I wish existed the day I needed it. I'm going to walk you through the 5 most common quail illnesses, how to identify exactly which one you're dealing within under 2 minutes and what you can do about it right now. Most of it for under $5. Let's move fast because your birds can't wait. Before you grab any treatment, you need to know what you're fighting. Spend 60 seconds observing your sick bird from a distance without touching it. You are checking 5 things. First, the posture. Is the bird fluffed up and hunched? That signals internal distress, infection, parasites, or chilling. Is it standing normally but moving slowly? That points to something metabolic or nutritional. Second, the breathing. Watch the chest and tail. If the tail is bobbing up and down with every breath, or if you can hear a clicking or rattling sound, that is a respiratory emergency. Third, the droppings. Healthy quail droppings are firm and brown with a white tip. Watery yellow or green droppings mean digestive infection. Bloody droppings are a medical emergency and mean one thing specifically. We'll get to that in a moment. Fourth, the eyes and nose. Clear, bright eyes are healthy. Cloudy eyes, swollen eyelids, or any discharge from the nostrils means respiratory infection. Fifth, the weight. Pick the bird up and run your finger along the breastbone. If it feels sharp, like a blade instead of rounded, that bird has been losing weight for days. Something has been wrong longer than you realized. Write down what you observe. It will determine exactly which section of this video you need. If your bird has watery droppings, lethargy, and loss of appetite, especially in birds under 8 weeks old, this is your most likely culprit. Coccidiosis is caused by a microscopic parasite called Coccidia that lives in soil and spreads through droppings. It attacks the lining of the intestinal tract, preventing the bird from absorbing nutrients. In young quail, it can kill within 48 hours of visible symptoms appearing. Mild case, natural first response. The moment you see symptoms, isolate the sick bird immediately. Remove all wet or dirty bedding from your entire pen and replace it. Then add 1 tablespoon of raw, unfiltered apple cider vinegar per gallon of drinking water. Use only plastic or ceramic drinkers, never metal, as the acid reacts with it. This creates an acidic gut environment that suppresses coccidia growth and supports recovery in early-stage cases. Add a pinch of food-grade activated charcoal to their feed to help bind the toxins the parasite is releasing into the bloodstream. Moderate case, when natural isn't enough. If symptoms do not improve within 24 hours, you need Amprolium, sold under the brand name Corid in the US and Coccioid in the UK. This is available at any farm supply store without a prescription. Mix it according to the package instructions and treat the entire flock through the drinking water for 5 to 7 days. Pro tip, never mix Corid and apple cider vinegar in the water at the same time. The acid destroys. The medication. Do the natural route first, but if you switch to Corid, use plain water only. After the treatment course ends, add probiotic powder to their water for 1 full week to rebuild the gut bacteria. The medication disrupts. Emergency signal. Bloody droppings mean severe coccidiosis. Start Amprolium immediately. If you see bloody droppings in multiple birds at the same time, call a vet. That is an outbreak, not an individual case. If your bird has tail bobbing, clicking or rattling breath, nasal discharge, swollen eyes, or is holding its beak slightly open, this is a respiratory infection. The most common cause in backyard quail is Mycoplasma, a bacteria that spreads through the air between birds and through contaminated equipment. Cold drafts, wet bedding, and overcrowding are the conditions that allow it to take hold. Mild case, natural first response. Isolate the bird immediately to stop airborne spread. Move it somewhere warm, dry, and completely draft-free. Add 1 teaspoon of raw apple cider vinegar per gallon of water to support immune function. You can also add a small amount of oregano oil, 2 to 3 drops per gallon, which research shows has natural antimicrobial properties in poultry. Increase ventilation in your main pen without creating cold drafts. This means airflow above the birds, not across them. Moderate case, if symptoms persist beyond 48 hours or spread to additional birds, you need a broad-spectrum antibiotic. Tylosin or doxycycline, both available at farm supply stores, are the standard treatment for Mycoplasma in poultry. Treat through the drinking water for the full course. Never stop early, just because symptoms improve. Stopping antibiotics early is exactly how resistant bacteria develop. Emergency signal, open mouth breathing, blue or purple coloring around the beak, or a bird that can no longer stand upright. That bird needs a vet, not a home remedy. These are signs of severe pneumonia or Newcastle disease, and Newcastle disease has no cure. This one is called Quail disease for a reason. It is caused by the bacteria Clostridium calinum, and it hits fast, hard, and silently. A bird can appear completely normal in the morning and be dead by the afternoon. The warning signs are sudden weight loss, white watery droppings, hunched posture, and a bird that stops competing at the feeder. The bacteria spreads through droppings, contaminated water, and flies that have been in contact with sick birds. Prevention. This one is about prevention more than cure. Keep your pen dry. Wet litter is the single biggest risk factor. Remove droppings daily. Keep wild birds and flies out of your feeding area. Add apple cider vinegar to the water regularly as a preventative gut acidifier. Treatment: bacitracin or tetracycline in the drinking water. These are available at farm supply stores. Because this disease kills so fast, do not wait to see if natural remedies work. If you see the symptoms, start antibiotics immediately and treat the entire flock. Emergency signal: multiple dead birds with no prior visible illness. That is the hallmark of an ulcerative enteritis outbreak. Quarantine your entire flock. Deep clean every surface with a disinfectant and consult a vet immediately. This one does not kill birds overnight, but it quietly drains your flock over weeks and destroys your egg production before you even notice what is happening. Mites and lice live on the skin and feathers of the bird, feeding on blood and skin cells. The signs are constant scratching and feather pecking, patchy feather loss, especially around the neck, and vent, pale combs from blood loss in severe cases, and a dramatic drop in egg production. To confirm, wait until night and check your birds with a flashlight. Red mites hide in the pen during the day and only come out at night to feed. If you see tiny red or gray dots moving on your birds or in the cracks of your pen, that is a red mite infestation. Natural treatment: food-grade diatomaceous earth dusted directly into the bedding, into the corners of the pen, and lightly onto the birds themselves. It works by physically damaging the exoskeleton of the mite and dehydrating it. It is completely non-toxic to your birds and to humans handling the eggs. Repeat every 3 to 4 days for 2 weeks. Moderate case, if diatomaceous earth alone is not clearing it within a week, use a permethrin-based poultry spray available at any farm supply store. Treat the birds in the entire pen, including every crack and crevice where mites hide during the day. The last category is the one that does not look like a disease at all, which is exactly why it is so often missed. If your birds have soft or deformed eggshells, weak or shaky legs, reduced laying that no disease explanation fits, or feathers that look dull and brittle, check what you are feeding them before you check for illness. The most common deficiencies in quail are calcium and vitamin D, which causes soft shells and weak bones. Never mixed into the main feed so birds can self-regulate. Vitamin A deficiency causes respiratory symptoms and eye discharge. You can correct this by adding crushed oyster shell in a separate dish. Always offer it free choice that can mimic infections. It comes from a diet lacking in fresh greens. Adding dark leafy vegetables like kale or spinach a few times per week corrects this within days. Vitamin E and selenium deficiency causes muscular weakness and twisted neck in young birds. Game bird starter with adequate protein corrects this at the feed level before it becomes a visible problem. Here's the system that saves flocks. Print this out or save this video. Watery droppings in young birds, Coccidiosis, start Amprolium, clicking breath, nasal discharge, respiratory infection, isolate and treat, sudden death with no warning, Ulcerative Enteritis, treat the whole flock now, scratching, feather loss, dropped egg production. Mites use diatomaceous earth tonight, soft shells, weak legs, dull feathers, nutritional deficiency, check the feed first. Apple cider vinegar in the water once a week. Dry, bedding every single day. New birds quarantine for 2 weeks before they touch your flock. Those 3 habits alone will prevent 80% of everything I just described. Which of these diseases have you dealt with? Drop it in the comments. I read everyone. Subscribe for more quail farming content, and I'll see you in the next one. Keep building.